Hello, my name is David Whitmore. I'm a paramedic manager with the London Ambulance Service NHS Trust, and I work directly to the medical director. I'm talking to you within this short video clip about the application process for international applicants applying for registration under the Health and Care Professions Council, which I'll refer to as the HCPC from now on, and how your application is dealt with by the HCPC and the information that they need, and indeed we need, in order to progress your application for registration here in the United Kingdom. You need to supply the HCPC with two quite important elements of your current practice, and I must stress it's your current practice. They are looking for a detailed synopsis of your education programme that led you to become a paramedic in your own country. Apart from that academic element, they also need to look at how you actually practice your profession in your country. So we're looking at two elements: the educational process and then the practice process. The HCPC, through the forms which are on their website, will look at how you were educated. They will look at the academic hours you spent either in a university or your training establishment, and the hours that you spent whilst in training working with an ambulance service. And we need to know whether that was as a supernumerary member of staff, or actually hands-on, or indeed a mixture of both. And we need to be very clear as to where that education took place. Was it in the hospital, in the operating theatres, in the emergency room, or out on the vehicle with ambulance staff? And again, was that supernumerary, or were you actually hands-on with the patients? A second very important element of your practice once you've actually qualified in your country is the autonomous practice. The HCPC have a document called the Standards of Proficiency for Paramedics. It's on their website and is a very important document, because it is this document that will assist you and the HCPC in deciding, can you be registered in the United Kingdom? Whilst all those standards are very important, one of the most particular standards, which does cause most applicants some problem in around explaining how they work in their country, is standard 1A6, and that is looking at autonomous practice. In the United Kingdom, I enjoy a high level of autonomy of practice when I'm with my patients. For example, if I'm taking a 12-lead ECG, I will take that 12-lead ECG, I will interpret it, and I will take my patient to the most suitable destination. I do not need to ask a doctor. I do not need to ask a higher level member of staff. It is my decision as a paramedic. Also, in terms of drugs, the drugs that I use, again, I do not need to ask a doctor to use those drugs. So in particular, the ceiling of care, if you like, in terms of drugs, are the drugs like morphine and diazepam. Again, those are drugs I use. I do not need to ask for a doctor. And you need to express that in your application as to how you actually practice your profession. If you're using drugs, can you use those autonomously? Which drugs can you use? Which drugs can you not use? In terms of skills, I've mentioned 12-lead ECG. Airway management skills, again, are the most important element that often cause some problems with applicants. And in particular, intubation. Intubation is not a skill that is absolutely necessary for registration here in the United Kingdom. However, use of a laryngeal mask airway or an iGel or a similar supraglottic airway device, that is a required element of practice. And again, how you use those supraglottic devices, again, must be autonomous. So that's your benchmark, if you like, for what I do when I'm out on the streets of London, or indeed when I'm practicing my profession elsewhere in the United Kingdom. And you need to make that very clear through what the documentation and the description of how you work in your country. So just to recap, if I may, on the education side, we need to look at the course programme. So you will need to supply a transcript of the course programme, how many hours that took in terms of academic hours and in terms of practice hours. I also need to know, how were you assessed? Was that done purely through paper-based exams, workbooks, practice placement documents, OSCE type examinations, vivas, and the weighting that was given to those assessments towards your actual final qualification. And then again, I said in terms of your autonomous practice, please explain to us how it is you work out on the road. As I was explaining earlier, the important factors which the HCPC assessors are looking for is very much how do you work in the back of the vehicle, the ambulance, or indeed from a car, a response car, and also out on the streets or in somebody's home. The kit that you're using, the drugs that you use, and things like the defibrillator. Are you the person taking the 12-lead ECG and interpreting and making the clinical decisions as to where that patient is best cared for? In terms of the drugs that you use, this is just an example of some of the drugs used in the United Kingdom. We work to national clinical guidelines. If you have something similar in your service, that is the sort of information of really important use to the HCPC assessors. If that can be submitted either electronically, which is more preferable, or as a hard copy, that is very, very useful. So we're looking at things like IV paracetamol, these sorts of drugs. How do you use those? How are you taught to use them? How are you educated? And again, can you use these sorts of drugs, IV paracetamol, oral morphine, things like benzyl penicillin, morphine sulfate for injection? Are you able to use those drugs, this equipment, work in the back of this vehicle autonomously? And where do you need to seek further advice from, if you do, from either from a doctor or from a higher grade paramedic? It is all those sorts of things which are of great importance to the HCPC assessors. And again, what we would need to see is the documentary evidence to how you were taught about your drugs, your equipment, your clinical decision making and your autonomous practice. I do hope this short film has been of use to you in your application, both to ourselves and to the HCPC. If you have any further information or inquiries that you wish from us, do please contact our recruitment team. Thank you very much.